we are looking at the breast cancer screening. So as we start, some questions. The first one is, what are the recommendations in case of the high risk category? And second question is, in case of the pregnant and breastfeeding women, how is the, or whether the mammogram and USG, it can be done or not done. So that is another question. In this video, we'll find the answers to these questions and learn in detail about this topic. So to begin with, firstly, we need to know the recommendations. So under the recommendations, there are various categories. So before that, the main recommendation is that the individuals, they are encouraged to do a risk assessment. So they do a risk assessment, and this is by 25 years of age. By 25 years of age, a risk assessment should be done, and this helps to categorize them into the average risk or the increased risk groups. So this will help to categorize them into the average or the increased risk groups. So now as we move on to the categories, the first one is the average risk. So what is meant by the average risk? So here it is not known a genetic or family history of breast cancer. So it is not known. It is no known. It is no known genetic or family history of breast cancer. So then what are the other things? Other thing is that from 25 to 39 years. 25 to 39 years of age, the clinical breast examination is done every 1 to 3 years. The breast examination is done. So just to recap, so we looked at the recommendation. So it is advised that the individuals, they have to do a risk assessment by the age of 25 years, and this helps them to classify into the average as well as the increased risk category. So first, when you look at the average risk, there is no known genetic or family history of the breast cancer. So when we break down the age from 25 to 39 years, it is 1 to 3 years you do a breast examination. So next one to continue with, so this was from 25 to 39 years. So what about ages greater than this? So in cases of, it is greater than 40 years. So greater than 40 years, and the clinical breast examination and the mammogram annually. So you do a clinical breast examination as well as the mammogram. Mammogram is done, and this is done annually. Next, we look at the high risk. So what is meant by the high risk? So high risk basically means that there is a positive family or genetic history. The positive family or the genetic history and the history of the breast cancer. Then there is also, what we need to do is consult a healthcare professional every 6 to 12 months. So you consult a healthcare professional, and this is done every 6 to 12 months after 21 years of age. So you consult every 6 to 12 months after 21 years of age. Then there is also the annual mammogram or MRI. There is a concept of the annual mammogram or the MRI, and this is from 25 years of age. From 25 years of age or 10 years prior to the age at which, or 10 years prior. So 10 years prior. So what does this 10 years prior mean? It is 10 years prior to the age at which the youngest family member was diagnosed with breast cancer. So 10 years prior the cancer of the youngest age in the family. So just to recap, we saw in case of greater than 40 years, this is under the average. The average. This is under the average. So under average, greater than 40 years, you do a clinical breast examination as well as the mammogram is done annually. Then when we move on to the high risk, there is a positive, there is a family and the genetic history. And in such a case, what we do is, in the family and genetic history of positive breast cancer. So here in such case, we consult a health care professional. So you consult a healthcare professional every 6 to 12 months. And this is after the age of 21 years. After 21 years. And there is an annual mammogram which is also done. And this is done in case of 25 years of age or 10 years prior to the family member who has the youngest age and has the breast cancer. Next category is the asymptomatic. So asymptomatic woman with previously treated breast cancer. So asymptomatic woman with previous treated breast cancer. And here what we do is we consult a healthcare professional every 6 to 12 months. So consult healthcare professional every 6 to 12 months. And then we also do an annual mammogram. There is also an annual mammogram which is done. And there is also an annual MRI. Annual MRI can be done. Annual MRI is considered. Next, there is a mammogram. Other point to note is the mammogram and the USG. Both of them, they are not contraindicated. That means it can be performed. So it is performed in case of the pregnant as well as the breastfeeding woman. So let's recap what we did here. So in terms of the asymptomatic woman, which means that they have asymptomatic with previously treated breast cancer. So in this case, we have to consult with the healthcare professional, and consulting is done every 6 to 12 months. There is an annual mammogram which is done, and there is also the annual MRI which can be done. Then when we look at the aspect of performing a mammogram or the USG in case of the pregnant and breastfeeding woman, it is not contraindicated, meaning it can be performed. Then we look at a category of high risk patients for the breast cancer. So who are known as a high risk? So what all falls under this? So it is basically a woman or a first degree relative. So a woman or a first degree relative, and this is with a known BRCA1 or BRCA2 mutation. So BRCA1 or BRCA2 mutation, or it can also include the TP53 or the P10 genes. So the first 2 degree relatives with breast cancer. So it includes the two first degree. It includes the 2 first degree relatives. And this is with the breast cancer, and it can include with or without the gene mutation. The next point is to note is that the women with history of the chest irradiation. And this is between the age 10 and 30. So let's recap what we did here. So we discussed the high risk category. So it includes the woman, that is the first degree relative with a known BRCA1 or BRCA2 mutation, as well as or the TP53 or the P10 gene as well. Next, the 2 first degree relatives, as well as the breast carcinoma and with or without the gene mutations. Next, the woman with history of the chest irradiation. This is between the 10 and 30. Between the ages 10 and 30. To continue with, there is also women with previously biopsy proven breast cancer. Women with previous biopsy proven breast cancer. And then there is also the woman with greater than 20%. So women with greater than 20%, this is the lifetime risk. Greater than 20%, this is the lifetime risk for the breast cancer. Lifetime risk for the breast cancer, and this is based on the breast cancer risk models. Breast cancer risk models. So to just recap what we did, in cases of women who have previous biopsy proven breast cancer, and in women which is greater than 20% of the lifetime risk, 20% lifetime risk for the breast cancer, and this is based on the breast cancer risk models. Now we'll move on to answering our questions. So we asked two questions. The first question was in terms of the high risk, how do you deal with the high risk? What is the recommendation? So in terms of the high risk, what is high risk? First of all, it is the positive family. So you have a positive family or genetic history. Positive family or genetic history of the breast cancer. So this is what is high risk. And what does it include? It includes that you need to consult the healthcare professional. So consult the healthcare professional, and this is done in it's done in every 6 to 12 months. So you do it every 6 to 12 months, and this is after 21 years of age. So this is after 21 years of age. Next, there is also the annual mammogram which can be done. Annual mammogram which can be done. So this annual mammogram is done from 25 years. It's done from 25 years, or there is another condition where it can be done in 10 years prior to the family member with the least number of age who has been diagnosed of the breast cancer. So the family member who has been diagnosed of the breast cancer, and among them who has the less age. So 10 years prior to that. Now we'll just recap what we did here. So we asked about the high risk. So high risk basically means the positive family history or genetic history of the breast cancer. So here you consult a healthcare professional every 6 to 12 months, and this is after 21 years of age. And annual mammogram is done at 25 years or 10 years prior to the family member with the breast cancer and has the least age. The second question we asked was, what about the mammogram? We asked about mammogram and USGUs. So how is it in case of the pregnant and the breastfeeding woman? So in terms of the pregnant and the breastfeeding woman, it is not contraindicated. It is not contraindicated. It means that it can be done. So it can be performed. So it is performed. So to recap here, we saw the mammogram and the USG. In terms of pregnancy and in case of breastfeeding, it is not contraindicated. That is, it can be used. So this was completely about the breast cancer screening. To learn and grow daily, please do subscribe.